Thank you very much.
Thank you for having me here. I will present part of my work on children's health risks caused by the oral absorption of trace metals and polyaromatic compounds that can be found in settled dust. As you may know, settled dust is defined as all particles that settle onto objects or surfaces, regardless of nature and origin. They have many different types of sources, including biomass combustion, industrial activities, heating, traffic, but it can also come from the erosion of soil or even the erosion of the buildings themselves. Settled dust are considered as environmental sinks for organic contaminants, especially for polycyclic aromatic hydrocarbons, PHs, and we can also find some metals and metalloids in these settled dust. So as you may know, PHs and metals are ubiquitous, they are found everywhere in the environment, and some are even carcinogenic. So PHs and metalloids can be found on the surface of the dust or even inside the dust. Children are exposed to settled dust through inhalation and skin absorption, but they have a specific exposure by ingestion. Since they crawl, they play on the ground and they bring objects in their hands to their mouth, so they can eat up to 100 milligrams of dust per day involuntarily. And children below 6 years old are a especially sensitive population to environmental contaminants since they are still growing. So risk assessments is usually performed with the total concentration of the contaminants in settled dust, and it may misestimate the risk as it is not representative of the bioavailability of the contaminants. And bioaccessibility, which is the fraction of the contaminants that will be free during digestion and that can be absorbed by the organism, is rarely described and measured in the literature, and it's more representative of the bioavailability of contaminants. So our question was, can the risk assessment approach foresee the genotoxicity of bioaccessible extracts of contaminants in settled dust? So we aim to assess the carcinogenic risk linked to the ingestion of settled dust by children, then determine the bioaccessibility of PHs and metalloids in settled dust, and finally, evaluate the genotoxicity of bioaccessible extracts on gastric cells. So we had 4 different sampling sites, one in industrial harbor, 2 in more city and harbor context, and finally a 4th one in a suburban area. All our sampling sites were preschools, and we sampled them at 2 seasons, so in summer and in winter. So as for our methodology, here we have the bioaccessibility extractions of metals and metalloids on the left, and the bioaccessibility of extraction of PHs on the right. So for metalloids, we used a simplified version of the United Barge method that was described by Pelfrin et al. In 2020, where we just added diluted HCl, and then we did the digestion at 37 degrees for an hour, filtered our extract, and then did a chemical analysis by ACPMS, or did our genotoxicity analysis. For PHs, we just added 10 milliliters of butanol. We did it twice for an extraction. We let it sediment too, then we filtered our supernatant, pulled the supernatant, dried them under a gentle flow, then divided our samples for a chemical analysis and for genotoxicity analysis. And we chose a method by Duran and al. that had a good correlation with the in vivo study. Our genotoxicity analysis, we had the COMET assay to evaluate DNA damage, and for the chromosomal damage, we used the CBMN assay. So first, I'm going to show you the incremental life cancer risk that we calculated according to the US EPA. So overall, the cancer risk was the highest in the industrial and the urban A preschools. Then we had the urban B preschool, and the lowest cancer risk was in the suburban preschool. Concerning the bioaccessibility of contaminants, in this case of metals and metalloids, overall it was of about 40%. And we divided our metals according into 4 groups. One with low bioaccessibility, like for aluminum and iron. Then we had, they had a bioaccessibility that was lower than 25%. Then we had the second group, which had a moderate bioaccessibility between 20 and 50%. So as you can see, for example, lanthanum or cerium. Then we had a high bioaccessibility group between 50% and 75%, for example, uranium. And finally, we had a group that had a very high bioaccessibility, such as zinc, for example. So it was kind of similar to other results by Dennis et al. And Rasmussen and Turner. For the bioaccessibility of pHs, overall we had a bioaccessibility of 12.7%. We had one anomaly for naphthalene in one sample where we observed a very high bioaccessibility, but its median was really low. It was nearly at 2 or 3%. And overall, pHs with low molecular weights were less bioaccessible than pHs with higher molecular weights. In terms of genotoxicity, so I'll start with the metallic extracts. So for the DNA damage on the left, you can see that we mostly had DNA damage only in summer, with the little suns indicated underneath. But we didn't really observe any DNA damage in winter in all the preschools. And we even had a significant seasonal difference in the industrial site and the urban B site. And finally, for chromosomal damage, we only had 2 sites that had a significant increase in chromosomal damage, so the industrial site and the urban B sites. Finally, it's quite different from our cancer risk. In terms of organic extracts, here we had all the samples that induced DNA damage. So on the left, DNA damage, on the right, chromosomal damage. And as you can see, the urban B and the suburban preschools, samples, induced the most DNA damage. For the chromosomal damage, the urban B preschool was the one that induced the most chromosomal damage, whereas the suburban preschool samples didn't induce as much chromosomal damage. So again, it was a bit different from what we saw with the cancer risk. Finally, we also did a PCA for the DNA damage, chromosomal damage, and the metal concentration in the bioaccessible fractions, and exactly the same thing, but with the pH concentrations in the bioaccessible fractions. So for the metals, we had our chromosomal damage, that's the percentage Mn, here that we can see that's correlated to cadmium along with the percentage tLDNA, and it's anti-correlated to zinc, cerium, copper, and lanthanum, more about. But for pHs on the right, we can see that the percentage tLDNA, so it's DNA damage, was not correlated to pHs, whereas our chromosomal damage was well correlated to pHs. Similar results were also observed by Bonnefoy et al. So in conclusion, pHs and MMs were characterized in cellular dust in preschools and also in their bioaccessible extracts. So there's further work to validate the overall bioaccessibility of compounds, especially for organic compounds. For cancer risk assessment and genotoxicity assessments, they may provide different results. So either we perform new risk assessments, including more contaminants, or we characterize contaminants in bioaccessible fractions. Both can be done. And finally, for genotoxic assessment of bioaccessible fractions, we saw that chromosomal damage was correlated to cadmium and pHs. And for DNA damage, it was correlated to cadmium, not to pHs. And we still wonder if our assay is a bit too sensitive for environmental studies, as it can be positive for contaminants that can induce direct or indirect genotoxicity. So it's still something to work around. And finally, we were wondering if we should apply also other tests, especially like the EMS test, that's quite used. So I thank you for your attention, and I wish to thank all our partners that made this work possible.